Imagine a workplace where violence isn't just a possibility, it's a daily reality. Where the people you are trying to help can become the source of the danger. And no, this isn't a war zone, it's a psychiatric ward. And if you've ever wondered how healthcare professionals break the cycle of violence and keep everyone safe, then stay tuned, because today we are diving into the strategies that can change everything. This is what I have learned from working in some of the most intense environment you can imagine. As a Navy medic, 6 years as a nurse in a high security psychiatric care facility, and for the last 1.5 years I've been helping to bring down violent episodes in the emergency department. I've seen it all, from patients in crisis to the toll it takes on healthcare workers. And today I want to share with you how you can break the violence spiral in healthcare, especially in a psychiatric setting. But most of the knowledge I will impart on you today can also be used in somatic care, and even when you are on a night out and see a violent episode. Let me take you back to one of my early days in psychiatric care. I was working the night shift, and one of our patients, let's call him Peter, had been waiting for his morning medication. He'd asked for it multiple times, but due to hospital protocols, he had to wait until the day shift arrived. When the day nurse finally came in, she told him there was a delay in getting his medication ready. Peter snapped. He threw a chair. My adrenaline was through the roof. He screamed, and I could feel a sense of unease. And the whole ward was on edge. The nurse was shaking, blaming herself for not handling it better. Back then, I was also shaking. I didn't know what to do. We ended up putting this poor guy in restraints. It felt uncomfortable. I felt like I had failed in my duties. But here's the thing. This wasn't just about Peter's reaction. It was about a system that didn't prepare us to handle the situation effectively. Violence in healthcare, especially in a psychiatric setting, isn't just about the patient's behavior. It's about the environment, the triggers, and how we as healthcare professionals respond. And let me tell you, it's not easy. I've been in situations where I felt completely powerless, where I questioned whether I could even keep myself safe. And if I can't keep myself safe, how can I keep my patients safe?
There is a way, but you won't like it.
But over the years, I've learned that breaking the violence spiral isn't just about controlling the situation. It's about understanding it. One of the biggest lessons I've learned is that violence often stems from unmet needs. Patients in psychiatric care are often in extreme emotional distress. They're scared, frustrated, and sometimes they feel like no one is listening. And when they're told no, whether it's about medication, a cigarette, or even just wanting to leave, it can trigger a violent reaction. But here's the kicker. It's not always the no that's the problem. It's how we deliver it. I remember another patient, let's call him Jens. He was brought in by the police after throwing potted plants out his window, one after another. According to the police, he said they had behaved badly. They shouldn't be in his apartment. I took the report, and when he arrived, he was visibly agitated, walking around in circles, screaming that he didn't want to be here, that he wanted to leave. I told him, "You can't leave. You came in with the police." That was it. He lashed out, hitting my shoulder. I was shaking, wondering if I'd been too confrontational. But the real issue wasn't my response. It was the lack of a system to de-escalate the situation before it got to that point. So how do we break this cycle? How do we create an environment where violence is less likely to happen? And when it does, how do we handle it in a way that keeps everyone safe? The answer lies in 3 key strategies: prevention, de-escalation, and reflection. Let's start with prevention. This is about creating an environment where patients feel heard and respected. It's about building relationships, the real, genuine connections. And I have seen firsthand how a simple good morning or asking a patient how they're feeling can make the world of difference. It's about setting clear, reasonable rules and explaining why they exist. Patients are far less likely to act out when they feel they are being treated with dignity and respect. Next up is de-escalation. This is where things get tricky. When a patient is agitated on the edge of losing control, that's when the real skill comes in. It's not about shutting them down, it's about calming them down. One time a patient was screaming at me, accusing me of not caring. And truth be told, every time a patient does that, it hurts in my heart. It really hurts. But instead of arguing back, I just listen. I let them vent. And you know what? They calm down when I do that. They just need to be heard. De-escalation is about understanding what's driving their behavior and helping them to find a way out of it. And then there's reflection. This is where we as healthcare professionals come together and talk about what happened. It's about sharing our experiences, learning from each other, and figuring out how we can do better the next time. And in reflection, it's important to remember, I don't want to point the finger at you because you did something stupid. I want to listen. What did you do? What worked? What didn't work? And why it didn't work and why it worked. Because that is how we learn. I have been in situations where I have been completely alone, wondering if I could have handled things differently. But when we come together as a team, when we reflect on what happened and why, we create a culture of support and learning. And that is how we break the violence spiral. So what's the takeaway here? Breaking down the violence spiral in healthcare isn't just about controlling patients. It's about understanding them. It's about creating an environment where patients feel safe and respected, where we as healthcare professionals have the tool to de-escalate situations before they turn violent. And it's about coming together as a team to reflect, learn, and grow. Now, I know what some of you might think. This sounds great, but does it really work? And to that I will say, yes, I have seen it work, I have lived it, and I have seen the difference it makes. Not just in the moment, but in the long term. Patients who feel respected are more likely to engage in the treatment. Staff who feel supported are more likely to stay in the job. And wards that embraces these strategies are safer, calmer, and more compassionate places for everyone. So whether you are a healthcare professional, a patient, or just someone who's curious about how we can do better in healthcare, then I recommend you watch this video next, because I like the information I share with you in this video, and YouTube also thinks you will love this video. So I'll be seeing you right over there.